Bonjour, Jill Anderson here again representing the Red Lake Hospital for administrators and medical staff. Today I would like to talk about some rumors and confusion concerning our clinic and emergency room. When the pandemic first hit the U.S., some orders were handed down that we did our best to follow. As our administration and the Red Lake Tribal Chairman said in previous statements, we got busy at that point making sure that we were going to be prepared to take care of the Red Lake community. Since that time, we have done just that. While this whole planning process was taking place, there was some confusion in the community and probably even among the staff here as to what we were able to do. This is what I'm going to try to explain so you know what to expect when you call the hospital. First, it's important to note that the clinic is open. We never did close, contrary to some rumors out there, and we're sorry if that's the message we were sending. What we did do is move quickly to change our protocol to make sure we weren't risking your safety. Having said that, we're still getting some feedback that people aren't really sure what they can come in for or what they should call their doctor about, and I'm hoping to clear that up for you. Second, you have the advantage of living in a small community with a group of healthcare workers that know you, know what's available to you, what hardships you might have, what risks you might face. And we take all of this into account when we come up with your treatment plan. Our focus is, and always has been, taking care of the people of Red Lake. Now, we realize that just because the coronavirus decided to show up uninvited doesn't mean that all the other diseases, disorders, and illnesses are taking a so-called break. In fact, because it could be on our doorstep any day, we need to make sure now more than ever that we are helping you to stay in the best condition you can, both physically and mentally. This way, if you end up getting the coronavirus, your body is at least prepared to fight. It means working with the doctors, nurses, and other staff here to keep monitoring and controlling things like diabetes, heart disease, pregnancy, and cholesterol, making sure blood pressure, STDs, and kidney disease are being managed, taking care of your mental well-being with the extra stress of a total change in lifestyle these past few weeks, all of those things and more. What has changed is how we go about your visit now. You will still get the same personal care from us. It just might not look or feel the same as before the pandemic. To make an appointment, just like before the pandemic, call the clinic. Here's where the differences start. You won't just talk to a scheduler. Instead, you'll probably talk to a nurse and possibly even your provider or a provider during this call. Based on the information they get from you after asking some exam questions, they'll make an informed decision on what's going to be the safest and most effective way to work with you. It might be a visit here in the clinic to see your provider face-to-face, or they might continue it as a visit over the phone and probably some follow-up calls. We're also working on making some of these calls video capable for several of our providers. It may include pairing you up with one of our wellness specialists if you're feeling anxiety or stress about this new normal. Our behavioral health staff is available, as always, to assist with these questions or concerns as well. Now, just because they see you for a telephone or video visit one time doesn't mean they'll treat everything that way. It is 100% a case-by-case basis. This is where our roadmap at the hospital has changed for right now. Because we're not all the same make and model, they can't necessarily put us into neat columns and rows and assume that every diabetes question or stomach ache can be treated according to some already decided protocol. We're still treating everyone individually, just like you deserve. Some people have said they're worried about how safe it is to come to the hospital or ER. We have made changes in our clinic in a few other ways to keep you and us safe. We're separating our well visits from our sick visits throughout the day, so you're less likely to be exposed to things. Just like in your homes and offices, the hospital cleaning protocol has gone on steroids. We're using our masks and personal protective equipment when needed and ask that you wear your cloth masks if you're coming in to keep you even more protected. We moved the chairs in our waiting rooms to keep 6 feet of distance between people. Our testing station for coronavirus is outside in a portable trailer. People who are being tested are likely never even walking through our doors. They drive up to get their test done. This means less risk of spreading the infection. The ER is taking all of these same cleaning and distancing measures and are asking the right questions the minute you get here to make the best decision about how to bring people in for treatment, who's safe to sit in the waiting room and who isn't. We have rooms for isolation if they need it, as well as their protective gear. Whatever the issue, question, or concern you have, please call us, 679-3912. You are our customers, our relatives, our family. We want to make sure we're giving you the best possible service. So if there's anything you think we could be doing better right now, please bring it to our attention. It's our job to take care of your health, and we want to do just that. Coronavirus isn't going anywhere anytime soon, so let's be as strong and healthy as we can in the meantime. Miigwech.